Welcome to Kwaderno Academy, empowering excellence through education. Join us as we inspire growth and unleash your potential. Let's dive in.
Have you ever really thought about what it takes to get back the ability to speak, or to think clearly, or even just to swallow your food? Well, today we're diving deep into the pretty high-stakes world of a speech-language pathologist who works in a skilled nursing facility. Let's get right into it. Just pause and think about that for a second. Speaking, thinking, swallowing, these are all things we do automatically, right? We don't even give them a second thought. But, for someone who's recovering from a major health event, it's this huge uphill battle, and that's exactly where an SLP steps in.
And the place where this all goes down is a skilled nursing facility, or what everyone calls an SNF. Now, this isn't a long-term home. Think of it more like a temporary battleground where patients are fighting like heck to get their independence back so they can finally go home.
So what's the mission here? First thing, you gotta forget any stereotypes you might have. This job is so much more than correcting a lisp. In a place like this, an SLP's role really boils down to three absolutely critical things: safety, function, and interaction. Okay, so let's get super clear on what an SNF actually is. The best way to think of it is as a short-term rehab bridge. Patients come here straight from the hospital for some really intensive therapy, and they all have one primary goal: get strong enough and safe enough to get back home. It's a really crucial step. Now here's something that probably surprises most people about what an SLP focuses on in this environment. A full 50% of their job is all about safe swallowing. The clinical term is dysphagia. The other half is split between cognition and communication. Yeah, you heard that right. Half their time is spent on something that is literally a matter of life and death.
So who are these patients they're working with? Well, a huge portion of them are recovering from something like a stroke or a traumatic brain injury. And in those cases, the SLP is tackling, the whole gamut, from language loss, which is called aphasia, to cognitive problems that could seriously put the patient's safety at risk.
And then you've got patients who have dementia or other cognitive issues. Now for them, the goal isn't a cure. It's all about maximizing their safety and their ability to function for as long as possible. The SLP might focus on memory strategies, or just making sure the patient can communicate their most basic needs, like saying, "I'm in pain."
You'll also see patients who are recovering from head and neck cancer. After surgery or radiation, their ability to speak and swallow can be just completely changed. So the SLP is there working on everything from trying to save their voice to teaching them brand new ways to swallow safely.
So when you boil it all down, it comes back to these four main goals. Every single therapy session is geared towards setting up a safe diet, getting functional communication back, boosting their awareness for safety, and, this part is huge, training the families and caregivers so they can continue that support at home. Okay, so how does this huge mission actually translate into a day-to-day routine? Well, it all kicks off with strategy. The first chunk of the day isn't even about therapy. It's about being a master planner, a strategist. And let me tell you, the morning is an absolute whirlwind. And everything, and I mean everything, is dictated by mealtimes. Swallowing evaluations are the #1 priority right after that 7 a.m. team huddle. And why is that? Because the SLP has to figure out if a patient can eat breakfast safely. A delay isn't just an inconvenience, it can be incredibly dangerous. Think about this for a second. Before an SLP even lays eyes on their first patient, they've already run through this 3-step strategic check. They've huddled with the nurses, they've prioritized their entire caseload based on who's at the highest risk for swallowing problems, and they've double-checked every chart. It's all about proactive safety.
All right, so once that game plan is locked in, the SLP shifts gears into their role as a hands-on clinician. And they've got this amazing, highly specialized toolkit to work with.
So 2 of the big therapies you'll always see are aphasia therapy and cognitive training. Aphasia therapy is all about rebuilding the brain's language centers so someone can speak and understand again. Cognitive training, on the other hand, that's more about targeting skills like memory and attention so a patient can just get through their day safely. They're 2 totally distinct problems, and they need 2 very different approaches.
And that toolkit is so incredibly diverse. It can be as low-tech as simple strengthening exercises for the tongue, or as high-tech as communication apps on an iPad for patients who can't speak at all. It even includes coaching sessions to empower the families. Every single tool is picked with one thing in mind: hitting a specific functional goal.
But here's the thing. No SLP works in a vacuum.
A patient's success really hinges on a massive team effort, which makes the SLP an absolutely critical collaborator.
Now check out this quote. This is the kind of super clinical language an SLP has to use in their notes. It's not just a memo, it's a legal and medical justification for their work. It's what proves why you need a highly skilled therapist to prevent a patient from, say, breathing food into their lungs, which is called aspiration.
And all the progress they make has to be tracked with cold, hard data. A therapy note isn't just going to say a patient is doing better. No way. It's going to say they improved from 40% accuracy to 60% accuracy on a very specific task. It is all about measurable, functional improvement.
You should really think of patient safety like a chain. The SLP, they're the ones who create the master plan for safe eating and communication. But then the nurses have to actually implement it, the occupational therapist has to work on self-feeding, and the dietary team has to get the food and liquid textures exactly right. If even one single link in that chain breaks, the patient is immediately put at risk.
So when you put all these pieces together, the strategy, the clinical skills, the teamwork, that's when you get to the true impact of what these clinicians do.
Because really, at the end of the day, all that data, all those clinical terms, they're just a means to an end. The real goal is just so profoundly human. It's about giving someone back the ability to talk with their family, the confidence to live by themselves, and the simple dignity of just enjoying a meal without being afraid.
So I want to leave you with this question. What if, for just one day, you couldn't tell someone you were thirsty, or hungry, or in pain? That's the reality these clinicians are fighting against every single day, working to restore the very functions that make us who we are.
Brought to you by Kwaderno KO. Learn smarter, not harder.